Hi there. Welcome to the part 2 of our complication of diabetes, right? Now, in the part 1, I was able to tell you the 4 complications that happens in diabetes, right? Now, I mentioned diabetic ketoacidosis. I mentioned the non-ketotic hyperosmolar coma. I also mentioned hypoglycemia and erectile dysfunction. I was able to explain to you how these complications happen. Now, if you want a link to the part 1, go to the description below. You'll find the link to the part 1 and other videos we've done right in this series. Okay, the major aim of this is to help you understand this condition called diabetes. Okay, I don't want you to be a victim, neither do I want anybody around you to be a victim, and that is why we are taking our time to do this video. Now let's dive into the part 2. The next complication that happens is diabetic retinopathy. Now, the retina is one of the essential part of your eye. Okay, it is the retina that controls your vision. Okay, now what happens is that when you have high blood sugar, there is a problem with the muscles that controls the action, okay, that takes place there. So because of the cells there, they are not receiving sugar enough, okay. Now you have issues with interpretation of what the eye is seeing. Okay, so sometimes you have blurry vision. Okay, you see the person that is having the person that used to see normally before, person starts seeing blurry. Okay, the vision is blurred, the cells are not able to get sugar, to function effectively, so it starts affecting the vision. Okay, you start having issues with the way you see. It starts with a blurry vision and can even lead to total blindness. That is why, as soon as you notice some of these signs, what you do is to run and go and get diagnosis from the doctor and start treatment immediately and take your treatment seriously. These are things you need to start doing, okay? Because the more time you waste, the more chances of complication. So you don't need to waste time. You need to start, taking your medication. You need to start taking them seriously so as to be able to, manage what is happening. Okay. So when you notice some of these things after seeing the doctor, there might be need for you to go see a an eye doctor, as an optometrist or an ophthalmologist, right? To look at your eye and know the level of damage that might have gone there. Sometimes when you start doing the right thing, your eye will clear. Okay, there may not be need for any further, treatment for the eye. Or when you start doing the right, but just go and see an optometrist or an ophthalmologist. Okay, the person knows exactly how to go about the treatment. Okay, next one is diabetic nephropathy. Now, I forgot to mention that nephropathy means nephron that is diseased. Okay, the same thing as retinopathy. It means retina that is diseased. Okay, so a disorder that has happened. Wherever you see pathy, you discover that there is disorder. So a diseased nephron. Now, a nephron is a part of the kidney that filters. Okay, it helps to filter the blood, that comes in, into the kidney. Now, nephrons, they are very vital in your in the function of your kidney. So when you have a high blood sugar, you discover that a lot of things, happen. You remember when I said that when fluid is drawn out of the cell, sugar is moved to the kidney. Okay, so that particular function that happens at that point, there's always fluid imbalance in the body. And those things, those functions that happen, they lead to the breakdown of these nephrons. Okay, they lead to the breakdown of these nephrons, and there's a problem with the nephron. And the kidney, at the same time, the kidney function is affected. So the kidney may not be able to filter blood as it ought to. Okay, and over time it can strike the heart. Okay, that's another thing. Okay, so when the kidney function is affected, you discover that um, over time, for somebody who is diabetic and you're not controlling it, you may start having edema, right? You start having swollen leg, you know, and all of those symptoms that happen, right? It shows that there's a problem with the fluid balance in your body, right? So it is time to see a nephrologist. You don't just see a normal physician at that point. Even the normal physician will tell you it's time to see a nephrologist. So if your complication has gotten to this point, please and please go see a nephrologist. Okay. Now, I may do a video for some of these complications to further, emphasize on certain things that happen during that period. All right. The next thing that happens as a complication is that there might be a heart disease, because a lot of things that affect the kidney usually affect the heart. Now, the heart is the organ of the body that pumps the blood, okay? And whatever it is that is in the blood, it is the heart that has control to pump it, to make it to get to where the body makes use of them, okay? So when the blood has high sugar, and when it moves to the kidney, it is filtered away. That means the heart, pumps blood. Okay, but when I explained about the hyperosmolar issue, where the fluid is drawn out of the cells into the blood, right? Now, this particular thing leads to a hypertension. That is, the blood, the fluid in the blood is increased. And when the fluid in the blood is increased, it means that pressure will increase. Okay, there's more pressure, and the heart needs to pump more than it used to, for it to meet up with the demands of the increase in the fluid that is in the blood. So this particular function leads to a problem for the heart. So the heart has to pump more than you know it's meant to, and it leads to a problem, a disease for the heart. Okay, it could lead to any form of heart disease, and which becomes a problem for the entire body, right? So this is one of the complications that also happens with that. But the genesis of this is from the diabetes. The genesis of it is from the diabetes. The last one is diabetes neuropathy. Diabetes neuropathy actually is, there are neurons that send signal. I know I mentioned it earlier. Neurons send signal to the brain to tell the brain what action to take for a particular function to happen, right? Now, when there's high blood sugar, the sugar in the blood corrodes these neurons, okay? The nerves that sends, these signals, it corrodes it. Now, when it corrodes it, it affects some of the function that needs to take place. When these nerves are corroded, it leads to some kind of tingling feeling, some kind of it leads to some kind of a pain, you know, some kind of numbness. Okay, you may not be able to feel your part of your body. It happens usually in the hands and in the feet. Now, when these things happen over a period, it leads to somebody might just be amputated, right? And when it happens that you are infected, that particular part of your body, maybe you had an infection under your toe or anything, you have serious issues on your hand, right? Now, that leads us to another complication, which might be called foot ulcer. Now, when the problem is that when these nerves are dead, okay, that you're not able to feel anything again. When you have wound, you may even hit something. Something might puncture your hand or your feet, and you're not able to know. You won't know. You may have a nail that will puncture your feet, and you're not able to know. You are not able to discover it, because you're no longer in charge of the nerve there. The nerve there, they are dead. Now, what happens is that you have a wound that is growing in your leg and you can't, find it. And because of the high blood sugar in your blood, that wound cannot go. Now, it leads to what is called foot ulcer. And from there, it can lead to gangrene, the eating up of your major nerves in the body. It could eat up the major nerves, and the doctor might say, my friend, we will need to cut off this leg. And then the only solution might be to cut off your leg. That is where you see people that are diabetic and they tell you their legs were cut off. That is a complication. Okay? Now, this is where we will draw the curtain on this episode of complication. This is the part 2. Like the part 1, I said the link will be in the description, and the link to other videos of the series, right? Now, the essence of this is to help you to know what you need to do. Like I said, there is a program for people who are willing to get the education they need and the knowledge they need to be able to control their sugar, and then the diet, the meal plan they need to be able to know exactly what they need to eat, the quantity they need to eat, and the time they need to eat. It helps you control your blood sugar. Now, I remain your dietitian, Fechi, and I'll see you in the next episode. Before we go, I'd like you to subscribe to this channel. If you've not subscribed, click on that subscribe button, click on the notification bell so that you'll be able to know when we release our videos on this channel. We are just here for you to help you know what works and what does not work in terms of your food, your nutrition, and your diet and overall health, right? Now, thank you for listening, and I'll see you in the next episode. Bye for now.